Ciprofloxacin is a powerful antibiotic that is widely used to treat bacterial infections. It has been approved by the FDA since 1987 and has been used successfully to treat a variety of infections, including urinary tract infections, respiratory infections, and skin infections. However, there are also some significant risks associated with its use. In this video, we'll explore the pros and cons of ciprofloxacin in detail, discussing its effectiveness, potential side effects, and more. The pros of ciprofloxacin. One of the main advantages of ciprofloxacin is its effectiveness in treating a wide range of bacterial infections. It has been shown to be highly effective against many strains of bacteria, including those that are resistant to other antibiotics. This makes it a valuable tool in the fight against bacterial infections. Another advantage of ciprofloxacin is its relatively short treatment course. Most courses of ciprofloxacin last for just a few days, which is shorter than many other antibiotics. This can be convenient for patients who have busy schedules or who may have difficulty remembering to take medication for longer periods of time. Ciprofloxacin is also available in both oral and intravenous forms, which can make it easier to administer to patients who may have difficulty swallowing pills or who require more immediate treatment. The flexibility of ciprofloxacin dosing means that it can be used to treat a variety of infections, including those that may be more difficult to treat with other antibiotics. The cons of ciprofloxacin. Despite its effectiveness, there are also some significant risks associated with ciprofloxacin. One of the most serious risks is the potential for tendon damage, particularly in older patients or those who are taking corticosteroids. Tendon damage can lead to severe pain, swelling, and even rupture, which can require surgery to repair. Another risk associated with ciprofloxacin is the potential for a serious allergic reaction. Although rare, some patients may experience anaphylaxis, a severe and potentially life-threatening allergic reaction that requires immediate medical attention. Other potential side effects of ciprofloxacin include gastrointestinal disturbances, headaches, and dizziness. Perhaps the most significant concern with ciprofloxacin is the potential for antibiotic resistance. Overuse and misuse of antibiotics can lead to the development of antibiotic-resistant bacteria, which can be difficult or impossible to treat with existing antibiotics. This can lead to more severe infections and increased healthcare costs. Risks and side effects of ciprofloxacin. Ciprofloxacin can cause a number of side effects, ranging from mild to severe. Some of the most common side effects include nausea, diarrhea, and vomiting. These side effects are usually mild and go away on their own, but if they persist or become severe, it's important to contact a healthcare provider. More serious side effects of ciprofloxacin are less common but can be more severe. These include tendon damage, which can lead to pain, swelling, and even rupture. Patients who experience tendon pain or swelling should stop taking ciprofloxacin immediately and contact their healthcare provider. Another potential side effect of ciprofloxacin is a serious allergic reaction, which can include difficulty breathing, swelling of the face or throat, and hives or rash. Patients who experience any of these symptoms should seek immediate medical attention. Ciprofloxacin alternatives. There are several alternative antibiotics that can be used to treat bacterial infections. These include amoxicillin, doxycycline, and azithromycin, among others. The choice of antibiotic will depend on the type and severity of the infection, as well as the patient's medical history and any allergies or sensitivities they may have. It's important to note that not all antibiotics are effective against all types of bacteria. Some bacteria may be resistant to certain antibiotics, which can make treatment more difficult. Additionally, the overuse and misuse of antibiotics can lead to the development of antibiotic-resistant bacteria, which can be more difficult to treat with existing antibiotics. When is ciprofloxacin necessary? Ciprofloxacin is typically used to treat bacterial infections that are resistant to other antibiotics or that are more difficult to treat. It may also be used to treat infections that are caused by multiple types of bacteria, or that involve a large area of the body. Ciprofloxacin is not typically used to treat viral infections, such as the flu or the common cold. Antibiotics are only effective against bacterial infections, and using them to treat viral infections can lead to the development of antibiotic-resistant bacteria. Ciprofloxacin dosage and usage. The dosage and duration of ciprofloxacin treatment will depend on the type and severity of the infection, as well as the patient's age and overall health. In general, ciprofloxacin is taken orally, either with or without food. The medication is typically taken twice a day for 7 to 14 days, although the exact duration of treatment may vary depending on the infection. It's important to take ciprofloxacin exactly as prescribed, even if symptoms improve before the medication is finished. Stopping treatment too soon can lead to a relapse of the infection, and can also increase the risk of developing antibiotic-resistant bacteria. Ciprofloxacin and children. Ciprofloxacin is generally not recommended for use in children, particularly those under the age of 18. This is because of the potential for tendon damage and other serious side effects, which can be more severe in younger patients. In rare cases, ciprofloxacin may be prescribed to children who have severe or life-threatening infections that have not responded to other antibiotics. In these cases, the benefits of the medication may outweigh the risks. Ciprofloxacin and pregnancy. Ciprofloxacin is generally not recommended for use during pregnancy, particularly in the first trimester. This is because of the potential for fetal harm, including the risk of birth defects. In some cases, ciprofloxacin may be prescribed to pregnant women who have severe or life-threatening infections that have not responded to other antibiotics. In these cases, the benefits of the medication may outweigh the risks. Conclusion: is ciprofloxacin worth the risk? Ciprofloxacin is a powerful antibiotic that can be highly effective in treating bacterial infections. However, it also carries some significant risks, including the potential for tendon damage, allergic reactions, and the development of antibiotic-resistant bacteria. Before taking ciprofloxacin, it's important to carefully weigh the potential benefits against the potential risks. Patients should discuss any concerns they may have with their healthcare provider, and should be aware of the signs and symptoms of any potential side effects. In some cases, ciprofloxacin may be the best option for treating a bacterial infection. However, in other cases, alternative antibiotics may be just as effective and may carry fewer risks. Ultimately, the decision to take ciprofloxacin should be based on a careful consideration of the individual patient's needs and medical history. Thanks for watching.